Ed Gein. He was known to be a quiet, pretty introverted man who really became famous in the 1950s when police found his home filled with human remnants. Furniture made out of human skin, bones, various genitals and body parts, lips, nipples, and a lot of evidence of grave robbing. He was diagnosed with schizophrenia, but what does that really mean? People have this preconceived notion that people with schizophrenia are violent. No, 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 they're not. Just like all humans, people can become violent. And that was kind of his situation. You can see in the video one of the dead people coming to life and talking to him. It led him to develop very unhealthy behaviors, like being with the dead body for long periods of time, even though they were cadaver flies everywhere. Individuals with intellectual and developmental disabilities, and this includes autism spectrum disorder, his sensory impairment, or hypersensitivity, or unusual interest in the sensory aspect of his environment. Can you think about what that was? Skin. We'll also talk about the sexual and gender aspects that I know are very controversial. I'm going to give you one way to look at it. Hello everyone, welcome back to Dr. Moss's channel. I am Dr. Moss, the second year psychiatry resident, and today we're diving into one of the most infamous and pretty disturbing forensic psychiatry cases in US history, Ed Gein. I just finished watching the Netflix documentary Monster, Ed Gein's story about him, and oh my god, that was fascinating and so interesting because I just finished my 3 months at forensic psychiatry, specifically a place just like where Ed Gein stayed after he got arrested until he died. I got to work in that facility with other murderers just like him. Definitely, it brought me another perspective on the mental health of individuals, and I can't wait to share with you. I've seen other YouTube videos, and I've been really kind of sad that individuals have been really focused on the killing instead of his psychosis and schizophrenia. Let's get into that blurry line between mental illness and criminal behavior, like what he did. I'm going to break down some common questions that individuals have after watching these videos. First, why? Why did Ed Gein do what he did? Second, are people with schizophrenia violent? And how do psychiatrists like myself determine if someone is fit or unfit to stand trial? Let's unpack it together from a psychiatrist mental health perspective. So make sure you like and subscribe and watch till the end to let me know what you think about this interpretation and analysis. A lot of people really liked my last video looking at the adolescence, looking at the dynamic between a child and a psychologist, but let's look at more from a psychiatry and psychology perspective using the one and only DSM-5 TR, so the most recent. I'll be talking about how, if I had met him for the first time, how would I analyze him? Let's talk about what these types of mental illnesses are based on what we know about him. And let's get into this. And I apologize in advance if I say Ed Gein and Ed Gein. I think it's Ed Gein. But I'm so excited to explain and have a great conversation about him and other individuals based on my experience being a psychiatry resident. Let's start from the beginning. Oh, I will do spoilers. So if you haven't watched the Netflix video, go watch it. Or maybe wait, watch the rest of this video to really get an idea, a different perspective to what you can look at and how you can see it. Maybe see it again and see if you can catch the things that I was catching during the episodes. So, as a broad overview, Ed Gein lived in Plainfield, Wisconsin, which he moved when he was little. And he was known to be a quiet, pretty introverted man who really became famous in the 1950s when police found his home filled with human remnants. Furniture made out of human skin, bones, various genitals and body parts, lips, nipples, and a lot of evidence of grave robbing. Later on, when he went to the mental health institution, he was diagnosed with schizophrenia. But what does that really mean? There are signs that he had it, especially throughout the movie. I was like, ooh, I think he has a mental illness. And then later on, they said schizophrenia. He was labeled as a sexual psychopath. But what did that mean psychiatrically and medically? So let's look at the biology of schizophrenia. Let's break it down. Psychosis. What is psychosis? And then we'll build off of that. So this video will also be helpful if you're going into medicine, going into psychiatry, to really understand. This is something I talk with my medical students who are rotating with me often, differentiating all these different aspects. Let's start psychosis. So that is the loss of connection with reality around you. That can be with hallucinations, seeing, hearing, feeling things that are not physically there. Your eyes are not actually taking in the image, so it's not physically there. Hearing things that are not at the wavelengths are not coming in, so your brain is producing it. And then delusions. There are a lot of different types of delusions, but the main thing about delusion is a thought process that you think of something which is not true and you're hyper focused. And even if you're told contrary information, you're very focused on that delusion. And disorganized thinking, you cannot think in a straight line or articulate your thoughts. People are listening to you and just it cannot connect of what they're saying. That's called disorganized thinking or a disorganized conversation. Something really interesting about these hallucinations is that they believe they're on the outside. When I'm interviewing someone who says they hear or see things that aren't there, I ask them, is it coming from your head? Or do you know the voice? Do you not know the voice? Where in the room it's coming from? So if you see the Ed Gein Netflix series, he said it comes from the wall. Sometimes I have patients say it comes from something that's been implanted that they actually hear, or coming physically from behind them, so they can tell it's external to their own self. Versus, I'm sure you have your own thoughts and maybe you remember a thought of someone else talking, but this is different. This is literally, it sounds like they're external. So people can have full on conversations and it looks like they're having a conversation with themselves because they're answering, they're literally talking out loud, they're not talking inside. And they hear that this individual is copying back, but they're not, there's no one. They'd be like, there's no response, but they're responding. That is such a common thing, especially in any psych ward. With someone who has some side of psychosis, you just hear them talking or screaming in their room. They don't like this. Would you like someone keeping you awake or saying mean, aggressive things to you? It doesn't have to be aggressive. Things can be nice things, but that's a lot of time. I love that in the movie they even said, like, shut up, because I've heard that. Like, people in their room, they're just screaming, shut up, because literally they can't, they sound like it's driving them, I want to say crazy, because so many words. One of the patients that I talked to described it really well in that it's like they're in a busy room, like if she's at a concert or in a room where everyone's talking and she cannot understand what they're saying. She's trying to focus on a friend, but everyone's talking. So she literally cannot deal with all these thoughts and conversations that are going on. One of the patients I talked to called it a council of individuals. It wasn't just one individual. Sometimes it ended up that she could talk to one individual. I'm getting ahead of myself, so sorry. And what I want to talk about hallucination is they don't have to be all the time. Sometimes they're periodic. And that really is what helps us determine what type of mental illness. Do they hear these voices or have these delusions all the time, or is it just during certain periods of their life? I wanted to mention the waking up. I've always heard about it, but had never experienced until most recently. I talked with someone who had been taking antipsychotic medications for months. She was like, I don't remember, everything's blurry, but I remember coming here 6 months ago, and she didn't recognize the date. It was like this blank period of she remembered getting here, and then she remembers the conversation we're having today, but there's this huge blank period. And I really got excited when I heard the Ed Gein's story, because that's exactly what he was saying, especially when I was talking about the murdering. He did not remember. And even when they did the lie detector, which people aren't going to be upset that it doesn't work, it just checks your like respiratory or heart rate, because when you lie, usually you get anxious, but that's a whole nother thing. He honestly did not remember killing people. He did remember the grave digging, but that tells me he was in such a psychotic state that his mind wasn't actually putting that memory in his hippocampus, and he was not connecting the hippocampus, which is your memory storage, and your frontal lobe. So there was that psychosis specifically during that time. And I think that was a lot when he went into like the legal aspect of it, of determining, okay, during this crime, was your brain aware of what it was doing? Did you believe it is a negative, harmful thing? So we'll get to that in a bit. Okay, obviously, if you've seen, I get excited. Oh, I was talking about waking up. So this lady, she said that she feels like she's woken up, that she was in a dream state, and now she can really think. And that's when I know the medication is working, that you're able to have that connection and interact with the world. That is our goal. That is good treatment. Another question that people always ask is, and I was so concerned about this Netflix video, because I was like, oh no, now people are going to see this. They're going to connect schizophrenia with being violent. Or people have this preconceived notion that people with schizophrenia are violent. No, 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 they're not. Just like all humans, people can become violent. And that was kind of his situation. Usually, for individuals with schizophrenia, if they do become violent, it can either be random or provoked. It's usually like when anyone, any neurotypical individual, when they feel threatened, persecuted, or provoked. I thought was a great example that the documentary came up with, when a female individual was provoking him, mocking him, and saying negative things about his mother. He had such a strong connection to his mother that he really got annoyed, got upset, anxious, and paranoid about being persecuted. And that's why he lashed out in anger. If you look, he doesn't actually kill that many people. I think it was like 5 or 7 total that they saw the Netflix show. He didn't depict all of them. More, he went and dug up people who are dead. Now, that's a whole conversation of, should he have done it? Is that an ethical thing to do? That's another conversation. We're talking about him and other individuals who have schizophrenia. I do want to say that because a lot of people that maybe you see on the street that are talking to themselves or being angry or saying, I'm gonna kill you, but they're not actually saying to you they're gonna kill you. They might be seeing the person, the hallucination that has been targeting them and saying mean things to them. That's who they're saying, I'm gonna kill you. Obviously, this got to me because these are just these are individuals struggling with their mental health. In this example that I just provided of people with schizophrenia maybe yelling that they're going to hurt someone, but they're talking to someone that you don't see, they're more likely to become victims themselves, because if they say that to the wrong person or someone who is not able to understand. I definitely had that situation in the psych ward, specifically at this forensic unit, where people that had schizophrenia were very angry. I'm thinking of a specific incident where they did say, I'm going to kill you. And they stomped all angry in this situation because I didn't let them have their phone, because they kept calling the police saying they'd be abducted. I just ignored them or said, hey, can you go to your room? And then later they came back and apologized. Let's go back. Let's talk about the different types of psychotic disorders. What types of psychosis and psychotic disorders would I consider? There are kind of three different levels that we think about based on the time frame. The one that lasts the shortest is a brief psychotic disorder. That can last anywhere from a day to less than a month. It usually can happen after something traumatic, something very sad, or just randomly. When they depicted his brother dying, when he realized that his brother was dead, he was so scared and anxious, and he even looked back and the brother got up and was like, hi. He was having a hallucination at that point. But that was a good depiction of a brief psychotic episode because the trauma of his brother dying, very traumatic. And then he started seeing his brother, talking to his brother. So the reality that his brother was now dead did not connect with the visual and auditory hallucination of him getting up. Interesting to note that 50% of people who have these disorders that have just one never have one again. They just have one episode. Now 50% do end up having another psychotic episode. And that's where we think, okay, this is not just a one-time thing. Maybe this is a longer lifetime illness. Even though I don't think that was the first time he had it because he was a lot older, and we'll talk about age in a moment. So next is schizophreniform, which can last from 1 month to 6 months. And about a third of people do actually recover and don't have it again. So they just have it for 5 to 6 months. That's it. And they can go on with their life. But unfortunately, 2/3, 2 out of 3 people that have schizophreniform do end up progress to schizophrenia. And I want to talk about an example case report, a patient who ended up having this diagnosis, schizophreniform, that he ended up killing their parents and was in this delusion that thing would go over and over and over. He would live in this episode that he would have to be killing his parents. So he was very upset and emotional about it and didn't want to kill, but he had this need that he needed to do that. It was horrible because he had this delusion, this thought that he would just constantly be reborn back to this day and end up killing his parents. So to prevent that from happening, he actually chopped off the genitals of his dad. Oh, whew. That story was just like, whew. Well, so interesting. If you get past that concept and you think about it, like, okay, I can kind of see how that individual jumped from that. He emotionally did not want to kill his parents again and did not want to live again in that thought. But what's so interesting about this patient is he had a life sentence of being in mental health hospital jail, mental health jail, and they were fine. They also had been a couple decades taking medications, and they just seemed neurotypical. You would have no idea they were having a psychotic episode. They did really well on psychotic medications. And not all the time that happens with, especially with these mental health disorders, but we know it was schizophreniform because it only lasted for a short period of time. And so really for this individual, the medication was more to prevent him from progressing, which was an interesting aspect. Anyway, let's get to Ed Gein. Schizophrenia. Anything longer than 6 months, that's where we know it's going to be schizophrenia and a lifetime illness. This often emerges in late teens, early 20s, especially early 20s for boys and men or individuals who are born male, and then later 20s for individuals who are born female. I thought that was really interesting because in the depiction, they talked about how a lot of the things they noticed of him digging up graves, doing stuff, was after his mom died. So his brother died when Ed was 38, again, too old for the first time. And then mom died only a year later when Ed was 39. So that really tells me that was not the first time. So DSM, schizophrenia, frenia. So Two or more of the following. Each present for a significant portion of time during a 1 month period. Delusions, hallucination, disorganized speech, frequent derailment or incoherence. Eventually, I'll actually do the mental status exam and explain it. Grossly disorganized, catatonic behavior. We can talk about another time of catatonia. And then negative symptoms. Negative symptoms can be the difficulty making emotional expression, also called flat affect. Avolition, so trouble having motivation to do things, more of almost like a depression. At least 1 month and then over 6 months so we can develop schizophrenia. And then this is the next criteria. For a significant portion of the time since the onset of the disturbance, level of functioning in one or more major areas, such as work, interpersonal relationships, self care, are markedly below the level achieved prior to the onset, or when in the onset is in child or adolescence, there's failure to achieve expected level of interpersonal, academic, or occupational functioning. Let's connect this back to Ed Gein. A big thing was him living with his mother. So his mother recognized that even as he got older, which happens, there is a point that kids become adults and are able to take on that responsibility. She recognized that he wasn't able to do that. And we recognize that when she died, his house was in full disarray. That has been reported multiple times. We call that ADLs, activities of daily living, knowing that you should be able to shower, eat healthy, being able to dress yourself with clean clothing, exercise. Like there's so many. And then there's IADLs, which are more higher level functioning, like being able to handle money, being able to go to school, able to have conversations with others, have romantic and non-romantic relationships, friendships. And if you look, he also struggled with that a lot, even as he was a child. And we'll talk about where I also think that in addition to schizophrenia, beforehand, he had a developmental intellectual disability based on what they were describing. But that will be later. Next one. Continuous signs of disturbance for at least 6 months. This 6 month period must include at least 1 month of symptoms that meet criteria A, or less if treated. It may include periods of prodromal or residual symptoms. During these prodromal or residual symptoms, the signs of the disturbance may be manifested by only negative symptoms, so sadness, depression, apathy, or by two or more symptoms in A, including odd beliefs, unusual perceptual experiences. And the odd beliefs, that's where I really want to talk about his fascination with death and his preconceived notion that he could do things that were not physically possible, like bring his mother back from the dead. And the fact that the mom kept him at the house really even gives me another idea of why she kept him at the house, because individuals with schizophrenia, especially we're talking about the 1940s, 1950s, like it was not talked about. They hid them, so it made even more sense to keep the kids, especially Ed. The brother got to leave, but not Ed. So it even made more sense of how, and I'm not justifying the mother because I know she had a lot of abuse and tendencies, but it makes sense to me why she kept him at the home, why she kept him away from people. And I want you to think about this is because she knew that people would make fun of him. She knew that he would not be able to get food to live. Even though he did have other jobs, he wasn't able to live on his own. He wasn't able to. I read that he actually tried to go to the army during World War II and they didn't allow him because he had something wrong with his eye. It also makes me wonder, because I have recruits all the time for the Navy, if someone comes in and we can tell that they have some type of mental illness, we wouldn't allow it. And so I'm sure at that point that was the same thing. So that's another aside, another experience that I have. Now, I do want to share because people sometimes question, like, can they just not have a job ever? And that's not the case either. They can have a job. Individuals with schizophrenia can have fully normal average IQ. It was estimated that a guy had an average IQ of 106. He read, he had intellect. But the thing is, even if that was the case, even though he learned how to do skills, he wasn't able to think critically, wasn't able to hold a job like, let's say, a banker or go to school. He dropped out of school in middle school. So that even tells me even more. It's very common for individuals in their teens that will develop schizophrenia. They do more commonly struggle with school, with friends. Maybe they start using substances. I'm not saying that if you drop out of school, start using substances, all that, you're going to develop schizophrenia. But we do notice that people who later develop schizophrenia have these patterns of struggling and having some sort of mental health, social connection struggle before they start to develop the full on psychotic disorder. The brother had died earlier. That could have been the first psychotic event. At least that's what they depicted on the TV show. But he was too old, 38. It's possible to have a first break, or only psychotic episode, but to develop schizophrenia, it's too late. There had to have been earlier ones that were just not talked about. A lot of time, an aspect of the illness is that they have a lack of insight into their disorder. A lot of my patients with schizophrenia don't believe that they have a mental illness. If what they're seeing and hearing is real to them, how in the world would they, given information to the contrary, they still just like, nope, there's no reason. And this is beyond just the mental health stigma. It's actually a part of the mental illness that it's difficult for them to make two and two of everyone else doesn't see things. So it's only me. I've had individuals with schizophrenia that end up eventually being able to say, yeah, I have schizophrenia, I have hallucinations, I have things that other people can't hear. They still hear them. Medication does help and makes them maybe quieter, but it doesn't make them go away. And that is a conversation I have to have a lot of times with my patients. This will not fully remove them. You might always have these, but maybe they become less triggering. Maybe it can help you be able to get a job, be able to live not just in the hospital, that they can live in a group home or live with their family and parents, and family doesn't have to worry about them getting hurt. I really like to compare individuals with schizophrenia like individuals with Alzheimer's and dementia. If you see individuals from that lens, I'm wondering if you have more compassion, because individuals with Alzheimer's, I'm still getting on a rabbit hole, but I hope this connects with you, might get lost. They're like, oh, I'm going to go on a walk, and then they cannot remember where they live. They cannot remember who they live with, the names. Individuals with schizophrenia, and notice I don't say schizophrenics, individuals with schizophrenia. And we actually looked at the brains and they look pretty similar. Individuals with schizophrenia have reduced brain volume, especially as they get older. Specifically their frontal and temporal cortex, which is a lot of the social, the talking, the complex reasoning. Same thing with Alzheimer's and dementia. If you have any more questions with schizophrenia, put them in the comments. I'm really happy to be doing this video to really talk about schizophrenia and hope to show some compassion to individuals. It's like any other mental illness. Think of depression. Someone's able to say, I am depressed. But individuals with schizophrenia cannot always say that. It's part of the mental illness that they struggle to say that and struggle to have that acceptance. The same thing with Alzheimer's. Individuals with Alzheimer's have difficulties understanding that they themselves are having memory issues. That's actually part of when we evaluate individuals. When someone says, like, hey, I'm having problems with memory, we're not looking at Alzheimer's. We're more looking at either normal aging or dementia. Versus if the family is noticing their memory problems, getting lost, forgetting things, forgetting the names of people, and the patient is not, then we're more looking at Alzheimer's. Same thing with schizophrenia. Let's get to the next section. So, those are the types of psychosis. Now let's get into something called schizoaffective disorder. Schizoaffective has a schizophrenia portion. It includes the schizophrenia psychotic feature. So all the time there's schizophrenia, or at least having that baseline. And then there are periods where they're either very depressed or have manic episodes. So these manic episodes are when they're not sleeping, they're talking really fast, they're having excess energy and motivation to do things that they're very passionate about, or maybe slightly passionate about before, but now really want to do it, or do situations that normally they wouldn't. Maybe they become hypersexual, maybe they go gambling, or I had a patient before who had this, that during her manic episode would write and self-publish tons of books on Amazon. And that was just like, wow, you not just have schizophrenia, you have that bipolar feature on top. And I know they said schizophrenia, and I don't know exactly. Let me see when schizoaffective was added to the DSM. So affective disorder, 1933. Okay, there was a reason they didn't diagnose Ed Gein with this, but I wonder. It would definitely still be on my differential, because there were definitely periods where he'd start to create furniture of the body, like kind of a hyper drive to do things. Especially it was depicted in the movie, have sex with the bodies, especially when we're talking about manic episodes where they wouldn't sleep and had high energy. He didn't go to dig graves in the daytime. He did it at night. You could think, okay, well, there's less people out at night, okay? But this was in a small rural town, and I have written down that he visited as many as over 40 cemeteries. He didn't have that conception that what he was doing was wrong. On at least 9 occasions, he dug up the coffins of newly buried middle aged women. So there is this intense drive to keep going, high energy. So it's possible. So that's a schizoaffective disorder. And it doesn't have to be the manic, it can be schizoaffective with occasional very strong depression. Having a depressed mood. If you're a medical provider, remember SIGI CAPS, sleep disturbance, interest disturbance, guilt, concentration, appetite, decreased or increased eating, P is psychomotor retardation. I don't like that word, like slowing down, going super slow, and then suicidality. I think they did show, yeah, there were aspects in the documentary Netflix that he became very depressed and very sad and wanted to die and wanted to be with his mother, which brings me to another aspect, but we'll talk about that later. I promise I'm only on coffee number one. This is just how I am when I'm excited and I'm passionate. Let's go next to bipolar. This is something that a lot of my medical students struggle with, the difference between schizoaffective and bipolar with psychotic features. As I mentioned, schizoaffective as schizophrenia is all the time with episodes of either mania or depression. In comparison, bipolar with psychotic features is that you just have that manic episode, and only during that manic episode or only during that depressive episode, you also have psychotic features of hallucinations, delusions. Once you're treated or once you stop having that episode, you go back to normal. These individuals are able to hold a job down. Not while they're in those episodes, it gets difficult. Maybe they have to take medical leave or get a new job because it's so difficult during that episode, but it's a shorter episode. When they're not in those episodes, they can go back to work, they can go back to taking care of their family, have a family. So I hope that makes sense, that difference. I've worked with medical students, future doctors that have bipolar. You can see my podcast, Life as a Patient Doctor, where you can have a mental illness and also be a doctor. And during their manic phases, they just pull out of studying. Maybe they take a leave of absence from school to take care of mental health or be in the psych ward to protect themselves from doing things that are maybe harmful to them. So, again, individuals, doctors can also have bipolar. I know we didn't talk a lot about Ed Gein just yet. Something else I was thinking about when watching this documentary on Netflix is trying to piece together his life, specifically the years he was younger. His neurodevelopment, that I believe even a lot of people had mentioned that he was developmentally stunted. We'll talk about that. That kind of brought me to other concept I wanted to talk about, how individuals who are under 25, so 25 is really where the brain is fully developed. That's why individuals who smoke before 25 years old can develop schizophrenia. Other concept, when individuals are under 25 and their sole caregiver dies, which importantly was his mother, this yearning became even worse. They mentioned that he had this intense yearning of wanting to be with his mother, so much that he grave dig to try to find his mother or try to find someone who looked like his mother. Later on, the person he ended up killing and reminded him of his mother. So always trying to be with her. I always thought it was one of the grief, because there are some griefs that do have hallucinations of the patient talking to them, but it's brief periods of time. So there are aspects of grief where that happens, but this was more an extreme amount, and that's where it did connect with it being more schizophrenia. I loved in the video that they had the mom rocking in the chair. That is a common hallucination, seeing someone that just died, but it's also kind of like a memory. I remember seeing them rocking in the chair versus actually seeing them in the chair. And I guess going back to when individuals are younger, especially at the emotional development that he was, it really had a huge impact on his self belief and who he was, how he saw himself, and how he acted. That for his hallucination, I do want to say that is also a common thing with individuals with schizophrenia. Everyone has it differently, and it commonly has something to do with them. They have a similar hallucination throughout their experience. Not often does it really change significantly. For him, it was related to seeing his mother, seeing his brother when they were dead. And it also made me think of, did he also have hallucinations about his friend being closer than she was? You can see in the video one of the dead people coming to life and talking to him. It led him to develop very unhealthy behaviors, like being with the dead body for long periods of time, even though there were cadaver flies everywhere. And I really, just seeing his house really reminded me and connected in my mind, oh, this is more than just grief. Because definitely when you have grief, you're very sad, and it's hard sometimes to pick up yourself and eat healthy or take care of the house, but this was an extreme amount. House being in complete disarray, trash everywhere, like to the extreme amount. And that kind of connected in my brain. It was in line with individuals who have schizophrenia. This is why a lot of times they have to be in a group home with a caregiver or in a mental health hospital, because they're not able to take care of their own needs. Taking care of the house, living, the electricity, his lights were off a lot of time, the heating was off, in addition not being able to work to get the money to turn on the heat, like all these things. It was like ticking in my box of like, oh yes, this makes sense, because individuals with schizophrenia would have trouble with that mental cognition of being able to think, okay, I need to pay the power bill, or I need to get money to pay the power bill. And he would go into these extremes where we would have to rob places to get money. But another thing I thought about, especially because he did have this prolonged grief regarding his mother, is something called prolonged grief disorder. And it's interesting because a lot of people have heard about the 5 stages of death, even though everyone has them in different orders. When you lose someone, especially someone important to you, for prolonged grief disorder, this grief and sadness is longer, extended a period of time, and other stuff starts coming with it. I believe he had this because part of prolonged grief disorder, and let's look it up, we have, it looks like, when we're looking at grief disorder, and it says the criteria is the death at least 12 months ago of a person who was close to the individual. If they are a children or adolescent or a teen, it's 6 months. And since the death, the development of persistent grief response characterized by one or two of the following symptoms, which have been present most days and has been to a significant degree. They've occurred nearly every day for at least the last month. So intense yearning and longing to be with the deceased person. I think about him always thinking and talking about his mother, and even going to her grave site to be closer to her, which is regular, but it kept going on so much that he even wanted to bring her back to life and live with her, even if it was a dead body. This is where it gets interesting. Preoccupation with thoughts or memories of the deceased person. And since the death, at least 3 of the following symptoms have been present most days to be clinically significant. Every day for the last month. Identity disruption, feeling like part of themselves has died with them has died with the person, like the mother. A marked disbelief about death. So he did say that a lot. He denied the death, even when people would tell him that she had died. He'd be like, nope, she's alive, she's upstairs. Part of that was also the hallucination of his schizophrenia. Avoidance of reminders that the person is dead. I read that he actually locked the door of her old room and kept everything the exact same. He didn't even want to go in her room and her area. Intense emotional pain, which can come out as anger, bitterness, sorrow related to death. Difficulty reintegrating into one's relationships and activities, which again, looking at him, he already struggled with connecting with other people and having other activities, and he actually developed more activities. So that doesn't really fit. So for this, they have to be at least 3. Emotional numbness, absence of marked reduction of emotional experience as a result of the death, which again can also be like schizophrenia, that apathy, that emotional disconnect, that dissociation, feeling like life is meaningless as a result of death, and intense loneliness. And this impacts social, occupational. This is important regarding cultural, because every single culture's experience is different in regards to how they treat death. However, individuals in different cultures can still have this prolonged grief disorder. So it's important that this new DSM-5-TR actually looked into adding in culture experience. And I like this sentence. The duration and severity of the bereavement clearly exceed expected social, cultural, and religious norms of that individual's culture and context. So we're talking about, for him, he lived in Wisconsin, and so in the United States. And then number 5, cannot be better explained by another mental disorder or a substance. Since he had schizophrenia, this fits with schizophrenia. However, I would wonder if he has kind of both. He had schizophrenia and then additionally prolonged grief disorder. I was trying to come up with if the DSM allows the combination or not, because it does allow, and I'm just speaking out loud here so you can think through my process. And the DSM's not always correct. It's just what we know of science and psychology to date. The most common comorbid disorders, so you can't have more than one, are MDD, major depressive, PTSD, post-traumatic stress disorder, substance use, and PTSD is more common. So you can't have both. So I would say maybe he has both schizophrenia and prolonged grief disorder, which I think is really cool because I haven't read or heard anyone else mention it. I really hope that helps bring another perspective into how he did. I'm not saying what he did was correct. I'm not saying how he dealt with it was correct or what he did was right. I'm just thinking about a lot of this had to do with his mother and exasperated when his mother died. So anyway, that was regarding prolonged grief disorder, and yeah. So there's an additional thing that I think he had. Now, this part is more the depression, or at least the depressive aspects. We call it the negative symptoms of schizophrenia. He spent a lot of time at home and disconnected from the world around him. Additionally, I thought it was really cool that they showed he did have moments of clarity where he was able to talk to the neighborhood and cops, not full conversations, but enough. And I think that really shows because when I've worked with individuals with schizophrenia, there are times where we're able to talk, and it's okay if what they're saying doesn't make sense or it doesn't make sense with reality around. It is a very common thing that individuals say how lonely they are and have hard time emotionally connecting with others. So I really connected with that concept because he was a loner and his mom kind of led him to be that way by moving him very far middle of nowhere But think about other individuals who were neurotypical or did not have a mental health condition like this. Maybe they would have moved somewhere else or brought in more of another friend, which they talk about that in the TV show. But yeah, that episode, that conversation he's had of being very lonely, I connected a lot in line with individuals who struggle with mental illness that have difficulty connecting with others. And that's why a lot of times they do well in mental health institutions because they're able to connect with their doctors, their nurses, the other patients, and become kind of friends with them or at least feel safe. Let me know what questions you have. Did it make sense? Did you learn anything new? Let me get into the childhood. I'm really excited. This is something that throughout the first couple episodes, I was really thinking about this. And I'm surprised a lot of people haven't mentioned it. Maybe it's because there's not a lot of psych background, but I do want to say I'm only a second year psychiatry resident, but before medical school, I was actually a caseworker for children with developmental and intellectual disabilities and how they were describing and depicting his experience. I wondered if he did have some developmental and intellectual disability. We're about to talk about his childhood and why I believe he had that prodromal stage. Even though they didn't talk about it, the little stuff that they were talking about and the information we learned about him later on was making me think that he had a neurodevelopmental disorder. So let's talk about the different signs that I saw. One of the things that people talk about is that he was seen as odd. He was maybe described as a simpleton, and that is an outdated word and term, but it is right now kind of someone who does have a neurodevelopmental or intellectual disability. It wasn't until 2010 with the ROSA law that they changed the term mental retardation to actually intellectual disability, which is a brain dysfunction influenced by both genetics and environment. An environment growing up of baby, toddler, elementary school, and also while the individual is pregnant. Some things I thought about is his father was known to be a very abusive alcoholic that could be even to the wife when she was pregnant. He could have gotten hurt. This is before vaccinations. This is, early 1900s. There weren't a lot of vaccines, so higher risk of getting infections, like something as simple as the flu. People didn't have flu shots. And that can have an increased risk on the pregnancy. And so some of the symptoms that we see is, and there's so many ways. That's why it's a broad spectrum. We spent a lot of the first half talking about psychosis, a whole spectrum of types of psychosis. So this is a whole variety. I'm not diagnosing him. I'm just providing my interpretation and my thoughts and ideas of the situation, which the goal is also hopefully that provides another emotional, like, I'm not excusing what he did, but I want to provide a little bit of understanding and clarification of maybe what might have led him to be how he is. I wasn't alive when he was, especially when he was a child, but this is based off of a little bit of research I've done and then also from the documentary. One of the big things that individuals with intellectual and developmental disabilities, and this includes autism spectrum disorder, which I was starting to think he was on the spectrum, is difficulties with social communication, both verbal and non-verbal. So he had difficulty communicating with kids his own age, difficulty having friends. Additionally, his mom wouldn't let him, it sounds like, but he even dropped out of school. So he didn't feel safe and included even at the school. Some other things that I noticed that could possibly be autistic behaviors is an intense fascination in one topic or in one type of topic. For him, it was death. And from a young age, he's known to have been a big reader. He read anatomy, books on death. He was interested in World War II, the Nazis. So, like, that intense fascination. And even if it was something socially not acceptable, that didn't stop him. He also had that, especially when he was younger, he mentioned that he was interested in head shrinkings, grave robbing. He learned a lot of these things and had intense fascination on learning as much as he could. He also was very interested. He lived on a farm, so he saw his parents slaughter animals. He became fascinated and wanted to partake in that. He called a lot of things his hobbies. Regarding death, he connected with the other girl in his town that also was fascinated with death and always talking about that topic. This is really where I was like, this seems like on the spectrum. His sensory impairment or focus, specifically hypersensitivity or unusual interest in the sensory aspect of his environment. Can you think about what that was? Skin. So move away from our bias that it was a human skin. He was fascinated in skin, and they demonstrated that before he skinned individuals. He really was fascinated with milk and warming skin. When he took care of his mother, he would rub skin and put cream on her. He had this intense love and passion for the textures, and that is very similar for individuals on the spectrum, that they have something that they like, some texture, or the complete opposite, something they just can't stand. It's been also described as like it crawls up in them, that they just can't handle it, like maybe velvet or maybe the texture of foods. A certain food, they're hypersensitory to it. Then obviously when he hit puberty, that turned more into a sexual fetish, which we'll get into the sexual aspect of it. But that is something that I don't think is talked about enough, because everyone was just so, especially back then, even now, it was so grotesque. And it is grotesque. I'm not excusing it. I'm just trying to think why. I think that's what you want to, the why. What if he also had that fascination with leather? Leather is skin of a cow. Similar type concept. He had a passion for that texture. And I think the documentary did a good job really showing that in different aspects. So watch the documentary again and see if you can catch all the times where he is interested in skin when the person is still alive. It's not that they're dead or alive, it's the skin itself. And so much that a passion is he wanted to work with it, putting it into clothing, wearing it into a skin suit. We'll talk about sexual fetishes later. Next, with individuals on the spectrum, having the sameness and routine. If you look, he always had the same can of beans. Always. Even when he was a child, he was always wanting the same thing. Part of it is like, okay, maybe it was like he wasn't able to cook anything, he didn't know how to cook, but he obviously got the cans. Oh, well, maybe it was like in Wisconsin, maybe that's the only type of can of beans they had in the store. Possible. That made me start thinking about like the sameness and routine. And then also the type of bowl that he used. They said it was his favorite bowl. Sameness and routine. Scalp or the skull. Sameness and routine connects with his intense fascination and hobby. When they can mold so many things together, that's when someone gets happy. What else? What else? Let's go back to the IQ I mentioned before. They said that I found that he had about an IQ of 106, but his max was an eighth grade level. And so maybe a little bit higher because you read a lot, but that was pretty much it. And I do want to say, like, individuals with developmental disabilities or autism, it doesn't say anything about their intellect, their IQ. Same thing with someone with a mental illness and schizophrenia. It doesn't mean that they have a low IQ. However, a lot of people in the community seem to recognize that he wasn't able to connect with individuals, which is again another common thing that individuals with autism or developmental disabilities or non-neurotypical, which is neurodiverse, very common with. I was kind of going back and forth with like, okay, when he was younger, it's very common that it could be a prodromal stage. That means that he hasn't quite developed to full hallucinations yet. And a fun fact I always like to tell my medical students is that individuals with autism have a 4 times more likelihood of developing schizophrenia. So it's actually pretty common. Individuals on the spectrum is that they struggle with understanding gender differentiation and gender roles. So that actually that aspect of gender is very common with individuals on the spectrum. A lot of this actually reminded me of drag. I wonder if this is a form of cross-dressing. This did not change his gender identity. I'm wondering if that also was an aspect of his cross-dressing to actually look like what, especially when he would wear like the brassiere or the bras of his mother or the other girl or the underwear. It was like wanting to know what it was like. What would it look like? To something that I think about is again fascination with skin. If you see a lot of the time they were very high quality fabrics that were super nice. Male underwear did not have like all these different things I'm thinking about in the background to try to understand because we can't ask him right now. So I do point a huge I don't think I can't remember, but I don't think they did a warning, and I wish they did a warning on the Netflix show because individuals who have sexual trauma would be very triggered by this. So I do want to provide that warning that we'll be talking about sort of things. Let's get into the sexual aspect since I did just mention it. I'm not going to explain a lot, but I'll give a little bit because I do have interest in working with individuals like this. And so I do want to mention because there is a lot of conversation online. And so I really want to explain this as much fact based that I can and respectful. It's up from the documentary and the history is that it was heterosexual. He was attracted to the female gender. Two, he had a dislike for his own body, specifically male genitalia. Some people say this makes him transgender, but that's not the case. Even in the Netflix documentary of how much the mom taught of the negativity of using his male genitals. Even there's this aspect where she's been known to have grabbed his genitals and called them a curse of man. So he a lot of times disliked that aspect of him, his genitals, because of his environment that he grew up with. Now, the next aspect is cross-dressing, dressing up as the other gender. So police found a lot of masks of women that he would wear, breasts, a full suit. A lot of this actually reminded me of drag. I wonder if this is a form of cross-dressing. This did not change his gender identity nor his sexual identity. So it made me wonder of this cross-dressing from the more 21st century version of it just being that of it being like a drag figure. And we have to talk about this wasn't talked about. This is still not talked about in society. He also had this fascination of the female gender, as you saw, taking a lot of effort and time to make sexual organs of the breasts and vulva into lamps, into furniture. So I think that is very demonstrate what he was sexually attracted to and what he was interested in. We have to think he could not just pull up a video of porn. This was his form of porn. And if we talk about if he also had schizophrenia, so wasn't sure what was real, what was not, if he also had a developmental disability, he was highly focused on his passion and not really understanding what is allowed, what is not allowed, what is right versus wrong, what is ethical, what is unethical. If he had interacted with other individuals longer, he would have learned, no, that's not okay. From a lot of, especially when we talk about kids or individuals of that intellectual level or developmental level, they're going to take information from their peers and knowledge to learn what is okay. And so, since he read a lot about anatomy books, we use those books in medicine. I did in medical school where we learned how to cut off bodies and look at organs in different ways respectfully. But if he didn't go to medical school, but he's learning from medical books, there's a disconnect there where he doesn't know what is respectful and what is not respectful, what is ethical and what is unethical regarding respecting bodies and body parts. Another thing I wanted to mention about him was like the books that he was reading. He was reading is they did a great job in the documentary talking about reading about a Nazi woman who would do something similar with skin. And so if he's reading about it and that was his peer, was his mentor, he idolized her. So he's learning from her what is okay, what is normal for him. And if he's so secluded, and if he's talking to all these voices that are encouraging, that's kind of where this mental disorder really goes in. And then finish off with talking about necrophilia. And so, necrophilia, by definition, is either sexual intercourse or attraction towards corpses. So, they did depict in the documentary, which was definitely very disturbing. And I think one of the things that he did, well, he didn't want to do it at first. He hadn't even considered it. And then they demonstrated in the show that it was provided as an idea or opportunity by someone he respected. Who knows if that's right or not, but let's say it was right that he didn't think about it, but he already had this kind of attraction to corpses or interest in sexual organs. And then someone who he liked and respected told him to have sexual intercourse or recommended it. He has a greater likelihood of falling through, not getting sarcasm, not getting societal values. Again, like I said, I'm not condoning it, I'm not encouraging it, I'm stating as much respectfully scientific understanding and facts from this individual and trying to, especially with the question of why did he do what he did? I'm trying to answer that question, at least from my understanding of the knowledge and research and education I have as a psychiatry resident. What were you getting at? I did want to mention though, something that was really meaningful was the fact that when he was having that experience with the corpse, he saw it as a live person. I think that says so much of his mental status while he was doing these legal and things that were non-ethical, is that he saw it as a live person. And you saw that in the video. Sometimes the person would become alive. Okay. Also, I do want to say, like, even more because he was so religiously and sexually repressed because of his religion, because of his family, because of the time period he lived. If he had any other experience, he wasn't able to have any sexual experience outside the house. His mother very much told him that he's never allowed to be with a woman. It made me start thinking that he never had that experience. Oof, that was a lot. And I haven't even gone into the forensic aspect. In part two, we're going to get into his evaluation, more of the forensic side. So I just gave more of a psychiatric way to analyze him, but now the forensics. In part two, I'll be doing a lot more videos of those, more of the medical psychiatric evaluation and education. I have videos where I talk about my forensic rotation and teaching about that. So watch one of those videos. I talked about the before he was arrested and what happened after. What did the mental health institution, the things that I'm like, they shouldn't be allowed to do that. Nowadays, the standards would be a lot different. In part two, we'll talk about the forensic, which is where I'll really bring in a lot of, I've been wanting to talk about my 3 months forensic experience and also talk about the different aspects of when we have individuals come in forensic, of how We determine if they're fit, unfit, and what happens going forward. Let me know what you think. I also have other videos. If you like learning about the medical side, psychiatric side of things, make sure you like and subscribe. Let me know what you think. Did I surprise you? What do you think of my interpretation? I'm gonna pause this video for now, and I'll see you in part 2. See ya. Ball. Hug my dog.